I did my research, and 3 out of 4 men on this panel are losing their hair. I don't want to mention any names, but one of us isn't.
Going.
I'm still holding on to bits and pieces.
Yes, of course.
So I'm sure men want to know how to prevent this and what contributes to this.
Oh boy. Well, Sam, that's the $1 million question. You've been blessed, but we really don't know the answer to that.
Right.
So there is certainly a genetic component. There's certainly a bit of a lifestyle component. But from a family medicine point of view, we say what's good for the skin is good for the heart. So the two things. So again, it comes
good for the skin.
Yeah,
It's
good for the heart. So that means a diet high in fruits and vegetables, right? Fruits and vegetables have an anti-inflammatory effect, so that's good for the scalps. That's where all the follicles are. And then exercise. Exercise comes up on every guideline, all research articles. That's certainly going to help.
Yeah.
Managing your stress. We have a condition in more women than men, but both of them, if you put someone under extreme stress, especially women, they could go completely bald.
Wow.
Fortunately, the vast majority, almost all of them, it'll bounce back.
I don't want to burst your bubble, but also
But it's coming.
there may be an association with less hair and higher levels of testosterone.
Oh wow.
And a couple of good examples of that is, one, men who take testosterone supplementations, some of them start to lose their hair.
Wow.
And two, one of the treatments for hair growth is a medication called Propecia, finasteride, Proscar. It's a medication used for the prostate normally, but it works to grow hair. And what it does is it actually blocks the conversion of testosterone. So if you block testosterone, you'll actually potentially grow more
Back
hair. Yeah.
So what do I do? Should I go bald?
Yeah.
To improve my health?
The problem with this medication is that so it helps you keep your hair, but it can also decrease, because it's affecting your testosterone. It can also decrease your libido and your sex drive.
So is me having a lot of hair mean
Means
that
you're
I
probably-
have low testosterone?
Probably, yeah.
See-
You're almost like a woman.
I have the balls to talk about it, Sam.
No, but is this true?
You know, Sam, the problem is in life and in medicine, there's never a free lunch.
Yeah.
You know, there's no
It's true.
free lunch. It's always like that.
What's really like, I thought of taking Propecia for hair. I
Yes.
heard about it.
Yes.
And Andrew had told me that, and I'm like, okay, so I'm going to have nice hair,
Yes.
but then I'm going to screw up my testosterone levels. And
Yes.
I was like,
How do you
kinda
find a
feel-
balance?
Yeah.
Well, I mean, most men who take Propecia, finasteride, don't have sexual issues, but there is definitely a percentage. And it could be long-lasting. So there's other treatments for hair growth. One is Rogaine or minoxidil. Daily, you can cream or gels. I've been using it for 15 years. So
Wow.
Impressive.
Is there a refund policy? Did you keep the receipts?
Yeah. So yeah, I get that often, but you know, he didn't take it, and look.
And I'm in the middle.
Yeah, perfect.
It goes this way.
But sometimes I just think, like, if you just shave it, it looks cool now. Like,
Yeah.
Yes.
Like,
Thank God.
like back in the day, it could have been like it wasn't the stuff, but now like guys who like
Yeah.
shave their scalp, it like just looks cool.
I just go to the hairdresser and I'm like, try to make it look like it's full. And thank God I'm tall because I have a big hole over here.
Well, I think the key is if you keep it short, it always looks cool.
Yeah.
It's the guys who keep it long and you really
Wrap it
see
around.
where you're missing it, and
Comb it
they
over.
flip it
It's like a
over.
Trump.
Yeah. I think like if you keep it short,
But hair
like,
transplants now are amazing. I mean, they take hair from the back and they pluck out each individual follicle.
Wow.
And I mean,
Micro-
they used to not be great. You can see the little pock marks all over your head, but now you would never know that it's someone had a hair transplant. They're
Wow.
really good.
And what's the cost for that?
Oh,
Hair transplants are expensive.
Very expensive.
$10,000, $15,000, $20,000.
Wow.
There's a huge industry, I guess, because it's cheaper in Turkey. It's one of the centers of the world for hair transplant.
Wow. But then you got to fly to Turkey.
Then you go to fly to Turkey.
I'm
God
great.
knows
Thanks.
what's
Yeah,
happening
yeah.
there.
And
There's one more treatment that I've been doing
Yeah.
is PRP. So PRP is we take blood, and we put it in your blood. We put it in a centrifuge and separate the red blood cells with the platelets. And the platelets, when activated, have growth factors. So when you get a cut, the platelets first come and stop the bleeding, and then they release the growth factors. Now, PRP, platelet-rich plasma, has been used in sports medicine, in aesthetics. You know, remember Kim Kardashian had the vampire facial?
Yeah.
So that was PRP. So now there's actually injecting it into the scalp for improvement of hair growth. Now, and it's been proven to work in, like all these treatments we're talking about, in a certain percentage of people.
I have a question. Can I take Sam's blood and PRP?
You're gonna be half Indian.
I want that hair.
Walking in the store asking for discounts for no reason.
So the surgery for that is basically it's a rim job. You go in with a camera through the prostate.
A rim job? Something?
Not a rim
No.
job.
I heard rim job.
Rim.
I was like,
What
kind of clinic you got going, man? What's happening at the Cary Square that we don't know about? I know there's free parking. Rim jobs.